Hey everyone, Nick Bruns here, Summit Eye Care of Wisconsin. What exactly is interventional glaucoma? Well, simply put, it's just a change in mindset. It's about being proactive rather than reactive. Remember, in glaucoma, our controllable variable is the pressure. We're trying to relieve the pressure on the nerve. One other variable that we do have some control over is time. We set our target pressure, and then theoretically, time spent above that target pressure or fluctuating above that target pressure can cause permanent compromise to the nerve, possible permanent vision compromise. Traditionally in glaucoma, we were all taught start with drops, wait for progression, consider doing a laser, maybe wait for progression, and then surgery is kind of last. When what we had available to us, decades ago was more invasive procedures like trabs and tubes. Well, fast forward to 2025, we have all sorts of new things available. We have procedural pharmaceuticals like Durista and iDose. We have several minimally invasive glaucoma surgeries, and of course, the use of lasers and SLT. Drops have limitations. When we prescribe drops, we assume that our patients are taking them compliantly, and there are several studies that really show that our patients aren't taking them compliantly at all. They also have risk profiles, specifically the impact on the ocular surface. And then finally, the cost and the burden on the patient and their family or their family or friends to instill the drop. Seems simple, moving from a drop first approach to a maybe more procedure first approach, but it's not common practice yet. But we're starting to see this idea really gain traction. And this was really recently enforced by the recently published Interventional Glaucoma Consensus Treatment Protocol. Basically what they did was they took 10 glaucoma specialists from across the country, locked them in a room and said, figure it out. What is the best way to handle glaucoma of different severities? And what they came up with was a generalized treatment approach based on severity, really highlighting procedural pharmaceuticals and laser earlier in your treatment protocols. And what they found was there's better control that way, and we certainly see that in our clinic. So when you hear the term interventional glaucoma, think of it as a paradigm shift. We're being more proactive rather than reactive, utilizing all of the new technologies that we have available to us. Thanks, everyone.